Make sure to read the patient information leaflet and instructions for use provided by your pharmacist before using the Epipen Jr. 2-Pak Auto-Injector. Keep this product near you at all times and check that it comes out of its carrying case easily. The solution in this product should be clear, so check it visually for particles or discoloration from time to time. Different brands of this medication have different directions for preparing and using it, so make sure to learn how to properly inject it ahead of time. The dosage is based on your medical condition, weight, and response to treatment. Inject this medication into the thigh as directed by your doctor and the manufacturer. It can be injected through clothing if needed. This medication acts quickly but does not last long, so get medical help right away after injecting it. Avoid injecting it into the hands, feet, buttocks, or other areas of your body, and discard the injector properly after use. If you have any questions, consult your doctor or pharmacist. Some common side effects of Epipen Jr. 2-Pak Auto-Injector may include fast or pounding heartbeat, nervousness, sweating, nausea, vomiting, trouble breathing, headache, dizziness, anxiety, shakiness, or pale skin. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. If you do experience any serious side effects, such as irregular heartbeat or signs of infection at the injection site, it's crucial to inform your doctor right away. In the case of very serious side effects like chest pain, fainting, vision changes, seizures, or confusion, seek immediate medical help. This is not an exhaustive list of possible side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. If you have any allergies, make sure to let your doctor or pharmacist know before using this medication. This product may contain inactive ingredients that can cause allergic reactions. It may also contain sulfites, but even if you have a sulfite allergy, you should still use this medication during an emergency. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have heart problems, high blood pressure, thyroid disease, or diabetes. This medication may cause dizziness. Avoid alcohol or marijuana while using this medication, as they can increase dizziness. Limit alcoholic beverages and talk to your doctor if you are using marijuana. Older adults may be more sensitive to the side effects of this drug, especially a rapid rise in blood pressure. If you are pregnant, you can use this drug in the same way as if you were not pregnant. It is unlikely to harm a nursing infant, but consult your doctor before breastfeeding. When using Epipen Jr. 2-Pak Auto-Injector, it is important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It is important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It is crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Epipen Jr. 2-Pak Auto-Injector. Remember, always consult with your healthcare professional for any concerns or questions regarding medication interactions. If someone has taken too much Epipen Jr. 2-Pak Auto-Injector and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include irregular heartbeat, fainting, changes in vision, confusion, and seizures. It's important to seek medical help if you or someone else is experiencing any of these symptoms after using Epipen Jr. 2-Pak Auto-Injector. Remember, it's important not to share this medication with anyone else. Each person's Epipen Jr. 2-Pak Auto-Injector is intended for their own use only. Epipen Jr. 2-Pak Auto-Injector is used to treat severe allergic reactions, including anaphylaxis, in children who weigh 33 to 66 pounds, 15 to 30 kilograms. It provides a single dose of epinephrine, which can help reverse the symptoms of an allergic reaction, such as hives, swelling of the face, lips, and throat, and difficulty breathing. It is important to carry this medication with you at all times if you or your child has a severe allergy. The optimal timing to use this medication is when symptoms of an allergic reaction first appear. The recommended daily dosage is as directed by a healthcare professional. When you have an Epipen Jr. 2-Pak Auto-Injector, it's important to store it properly. Keep it in the carrying case or original packaging at room temperature, away from light and moisture. Make sure to avoid extreme heat and cold, and do not store it in your vehicle or bathroom. It's also important not to refrigerate or freeze it. Remember to check the expiration date from time to time, and visually inspect the product for any particles or discoloration. If you see any, replace the unit before it expires. And always keep all medications away from children and pets. When it comes to proper disposal, do not flush medications down the toilet or pour them into a drain unless instructed to do so. When your medication expires or is no longer needed, be sure to consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.